The clinical is ulnar claw, hand of benediction, median claw, and gastric difficulties, also known as anterior interosseous syndrome. In case of ulnar claw, there will be a paralysis of hypothenor eminence. Here we have a hypothenor eminence. It will be affected in case of ulnar claw. Basically, the distal ulnar nerve is injured in the ulnar claw, so the area that are supplied by the dermatomes that are supplied by the ulnar nerve will be affected in case of ulnar claw. As you can see in pic, here we have interphalangeal joints of fourth and fifth finger. There will be a continuous state of flexion in ulnar claw hand. Okay, the flexion will occur at interphalangeal joints of fourth and fifth fingers, also known as the pinky and ring finger. Other name of ulnar claw is spinster's claw. The next clinical is hand of benediction. Here we have interphalangeal joints and metacarpophalangeal joints. That one is your metacarpophalangeal joints. Okay, so there will be a continuous state of extension at these joints, at interphalangeal joint and metacarpophalangeal joints of second and third digit. Okay, so the hand of benediction, basically it is a high degree of median nerve damage, or we can say it the median nerve injury. Okay, the lumbricals will be affected in case of hand of benediction. Index fingers and the middle finger is involved in case of hand of benediction. It has some kind of bishop's like configuration, so it is also known as a bishop's hand. Okay, the next clinical is median claw. Okay, the distal median nerve is injured in case of median claw. The opponent's pollicis or lumbricals are paralyzed. So you can see in pic, that one is your interphalangeal joint, so there will be a flexion at interphalangeal joints, and in case of fourth digit, the area supplied by the median nerve, there will be a extension at that area. The main digit that is involved in median claw is thumb, the pollicis. Okay, and second and third digit. Other names of the median claw is app hand deformity, Simeon's hand, app thumb deformity. Okay, next clinical is gastric difficulty, also known as anterior interosseous syndrome. Basically, the anterior interosseous nerve is injured in case of anterior interosseous syndrome. By the injury of anterior interosseous nerve, there will be a paralysis of flexor digitorum profundus and flexor pollicis longus. So flexor pollicis longus and flexor digitorum profundus will be paralyzed in case of injury to the anterior interosseous nerve. The thumb and the index finger is involved. Other name of gastric difficulty is anterior interosseous syndrome.